I know thousands of dentists, and I've got a good idea of what the arc of dentistry is like. I've seen those young, enthusiastic dentists gradually wear down over time. And usually what I see is it's due to the unrewarding nature of drill and fill dentistry. If you're feeling the weight of countless fillings and crowns, it's time to change the nature of your cases. I'll be back after the break to show you how. Thanks for watching the Patient Attraction Podcast. I'm Colin Receiver. Now, my dad is fortunate that he's had great success here in the Louisville, Kentucky market. And one of the things that I really admire about him is that he's just as enthusiastic about dentistry as he was 30 years ago. He loves what he does. And rather than, come to work or be frustrated or you got a difficult patient, he's excited to go in and be able to help somebody cure their problems and solve the dental troubles that they've had in the past. So they can't chew, they can't eat, they're embarrassed, whatever that pain is. Now, he can do that because he's getting the patients whose dental problems demand and challenge the skills that he has developed over time. Now, my dad, Dr. Receiver, owns and operates New Albany Implants. And he does more than just implants, of course, but implants are really what gets him out of bed in the morning. He has that kind of enthusiasm because he's getting the high quality, high value cases that he really loves doing, changing people's lives and making a difference. Now, I'm happy to say that we've been a part of that, helping him to develop the marketing systems and practices that have helped him to position himself as the expert and attract those types of patients. Now, if you've been in practice 15 or 20 years or more, my guess is maybe you're not as excited about getting out of bed in the morning as you once were. Maybe you're dreading hunching over the patients how your back's going to feel at 6 p.m. tonight. Maybe you're wondering whether dentistry is really a young man's game or young lady's game. Now, I can't say I blame you. So what are you going to do about it? Are you able to retire? And if you can retire, are you ready? If not, what do you need to do to get there? There's two questions, and the first is, what kind of patient are you marketing to? And the second question I like to ask is, what kind of patient are you getting? Now, if you've convinced yourself that all you can get are low case value patients, you're probably marketing on price specials and discounts. And I would give you one guess who's attracted to that kind of marketing: price shoppers, insurance-driven patients, and one and dones. You have an unending string of not very interesting and not very lucrative cases. You're working longer hours to make the practice profitable, and if your practice is as profitable as you'd like it to be. Now, what would happen if you marketed to a different kind of patient? 20% of your market has the ability and willingness to pay more for a dentist that they know, they like, and they trust. Don't believe it? Well, look at the statistics for yourself. Look at the 550 dentists that SmartBox works with who would disagree with you. They're killing it on their marketing, and they're not just getting more patients, they're getting better patients. I have it on good authority that a great many of them have found a new zest for dentistry. Quite a few of them have even arranged to cut back their hours. Now, if you want what those docs have, and you're serious about making a change for the better, check this out. Schedule a patient attraction blueprint session with us. These sessions we reserve for serious dentists who want to see what a patient attraction system that can double their practice looks like. Dr. CJ Landry from Louisiana said this, quote, "With SmartBox, they really followed up. They're putting in content that's relevant to our practice. Nowadays, our practice is so implant focused that SmartBox's marketing is sending me those patients, specifically those patients. In dentistry, it's cyclical. You have busy and slow. Since starting SmartBox, we're not really having slow times. I'm actually working harder and more than I did before, but that's my choice. It's also going to allow me to bring in an associate fairly soon because I need some relief from the work we're doing. In the past, it's been more of a headache worrying about finances. Now, I'm worrying about getting enough time off so I can enjoy the rewards." End quote. Now, sounds like a problem to have. You can continue to dread going to the office, or schedule a blueprint session with us and let us show you a better way. Get that burden off your shoulders. Enjoy dentistry again. Join me for our next podcast. Until then, keep moving forward.